Hi, I'm Dr. David Spiegel, Wilson Professor and Associate Chair of Psychiatry and Behavioral Sciences at Stanford University School of Medicine and co-founder of Reverie. Hypnosis is a naturally occurring state of mental function that can help you deal effectively and safely with a variety of problems for which there are pharmacological treatments, and I'm a doctor, I use medications with my patients. But there are times when enhancing your own ability to manage a problem like pain or stress can be equally or more effective than medication and safer. I was taught in medical school that if people have real pain and use opioids for real pain, they won't get addicted. That, it turns out, was just a flat-out lie. It is not true. And in fact, people who use opioids for pain control develop hyperalgesia. They have an exaggerated reaction to pain when they try to get off the drugs, which gets them addicted. This really bothers me because last year the Center for Disease Control estimated that 88,000 Americans died of opioid overdoses, and many of them were not suicides. They were not deliberate overdoses. They were accidental overdoses. Because what people don't realize about opioids is not only do they get more pain when they try to stop, but there are different receptors in the nervous system for two actions of opioids. One of them is the pleasure-giving and pain-killing aspect, and they can give you pleasure and reduce pain. The other controls your respiration. And so people think they need and can handle more opioids because their pain control is getting worse. What they do is they lie down, go to sleep, and they don't wake up. And there are drugs that are being put into the drug supply, the illicit drug supply now, like fentanyl and carfentanil, that are 50 or 100 times more potent than the standard opioids and will put you to sleep forever faster. So many of these drugs are dangerous. Anti-anxiety drugs, a similar but not as serious problem, you can get habituated to them and have some withdrawal problems if you try to stop them. They inhibit activity in the anterior cingulate cortex, the same part where hypnosis naturally inhibits activity. In fact, you've got your own little natural pharmacy in your cingulate cortex. More hypnotizable people have more binding of GABA, gamma-aminobutyric acid, a primary inhibitory neurotransmitter, in their anterior cingulate. So your brain is already poised to give you the same kind of anxiety relief that a prescription of a benzodiazepine would give you. So try using your own internal pharmacy first. And in fact, with Reverie, we have prepared a hypnopharmacy where basically you enter in your problems and you get a recommendation for which of the Reverie exercises you can use to effectively manage them. Control stress, deal with phobias, get to sleep, control pain. Hypnosis has been proven effective in dealing with problems like anxiety and pain. Our laboratory group published a study in 2000 in the leading British medical journal, The Lancet, randomized clinical trial involving 241 patients undergoing a kind of surgical procedure, an arterial cut down, for which we don't use general anesthesia. It takes about 2.5 hours. It stresses people and it's painful. And they were randomized to one of three conditions. They either could push a button and get opioids into their bloodstream. That's the standard care. They had that plus a friendly nurse providing emotional support in general. And they had that plus learning self-hypnosis. By the end of an hour and a half, the average pain level in the standard care group was 6 out of 10. In the nursing support group, 3 out of 10. In the hypnosis group, 1 out of 10. And they were using half as much opioid. They were pressing the buttons half as often as the patients in the standard care group. Their anxiety levels were 6 out of 10 for the standard care group, 3 out of 10 for the nursing group, and 0 for the hypnosis group. They were doing just fine. They got done 17 minutes faster on average. It actually saved the hospitals $348 a procedure. Now, if I published an article like that in The Lancet and I was using a drug instead of hypnosis, every hospital in the country would be using it. And one reason that's not the case is A, people don't get it, that the brain has a powerful effect on pain and anxiety. But also because I don't have a big business behind me sending ex-cheerleaders around to doctor's offices saying, try this drug or that drug. There isn't a whole lot of money to be made in it. It's just teaching people how to better manage their own health. Now, there are times when medications are the thing. The miracle that drug companies managed to develop within a couple of years, effective vaccines to prevent infection with SARS-CoV-2, is a wonderful thing. But there are situations where techniques that you can learn for yourself, like self-hypnosis for pain, stress, and anxiety and insomnia, allow you to choose an equally effective treatment with no side effects, no habituation, no overdose danger. I am deeply troubled that people still think hypnosis is either a stage show or dangerous, when in fact, the medications we are using are often far more dangerous. Nobody has ever died from an overdose of hypnosis, I can assure you. But thousands of Americans die every year. The CDC is estimating that this year, 111,000 Americans will die from opioid overdoses. That's terrible. So start out trying hypnosis once you've been to your doctor and you understand the cause of the pain you have. And when the pain itself is the problem, learn to use self-hypnosis to better manage and control the pain. Great treatment effects, no side effects. Try it, you'll like it. I hope you found this helpful. If you'd like to learn more about how hypnosis can help you change and improve your life, download Reverie. And if you'd like more information about hypnosis, please subscribe.